So, doctor, I think we're going to move on to the next question. The next question goes so, my recent ultrasound showed a fatty liver, but I don't drink alcohol. Should I be worried, and what does this actually mean?
You know, uh, Previously it used to be called as non-alcoholic fatty liver disease. You know, there's lots of causes of fatty liver to begin with. Okay, uh, two main common causes. One is your alcohol liver disease, and the other one is metabolic associated fatty liver disease. Right, dysmetabolism. So fatty liver is now being recognized more and more because of the changes in our dietary habits, in our lifestyles. Um, the liver is not handling the fat as it's supposed to. And it's a very complex mechanism again. It's the way your genes are interacting with your fat intake, and that determines the uptake of fat in the liver. So if there is abnormal storage of fats in your liver, you end up showing it on images like imaging like this, and that's a condition known as fatty liver disease, right? There are other conditions that we need to think of if you have fatty liver disease, things like hepatitis C, other inborn metabolic disorders of the liver, all of which can cause fatty liver. But in a common situation like what you're mentioning, most likely this is related to your metabolic alteration.
And, doctor, can something like fatty liver disease turn into something really serious, like cirrhosis, perhaps?
It is a rampant problem. It's a serious problem. It is a problem that needs to be addressed sooner than later, um, across the world, actually. And at least a third of the patients with fatty liver disease are at high risk of progression towards complications like cirrhosis and liver cancer. So yes, it's a very huge problem, and it needs to be addressed as soon as it is diagnosed.
What lifestyle changes would you recommend to people to reverse their fatty liver disease?
It depends on their comorbid conditions, meaning that what else do they have? If a person is diabetic, we have to make sure that their diabetes is well controlled. If somebody is obese, we have to target their obesity. Um, if somebody is taking other medications that promote fatty liver disease, like steroids and stuff like that, we have to make sure that we get rid of those or we optimize their use. So we try to find out or identify um, secondary causes first, like what else can be done, and then if nothing is found, it's a straightforward dysmetabolic associated fatty liver disease. We suggest lifestyle measures, which include aerobic graded exercises, along with reduction or uh, decreasing their carbohydrate intake, along with fat intake as well. So it's
Mhm.
all get towards a non-inflammatory kind of a diet, which helps with your liver.
And, doctor, how would you recommend that patients monitor their liver once they're diagnosed? Like, how often do you think they should get checked?
You know, uh, Different medical fraternities have different approaches to this. If somebody has been diagnosed of fatty liver disease, we try to identify whether this fatty liver disease is leading to inflammation, right? It's two different subsets. Starts off as fatty liver, but then as it progresses, it ends up causing inflammation in the liver. When then we do the blood test, we find out that the liver enzyme level is elevated, right? And if that condition is left untreated, it just progresses. It leads to more permanent damage, which is called fibrosis. And that's a precursor to irreversible condition called cirrhosis. So it depends where you are in the sequence of events, right? If you are already starting to see that your liver enzymes are going up, then I would suggest at least 3 to 6 months follow up with your healthcare professional, having regular blood work done. And these days, when you are being seen in the GI clinic, and at least in my clinic, what I end up doing is I try to identify people who are at high risk of progression to cirrhosis. So in those people, I suggest more intensive evaluation and testing.
Mhm. Thank you so much for your insights, doctor. And if anybody hearing this wants to further consult with Dr. Asad or any of our other doctors, please go on to our My American Doctor website. We provide telecommunication services with American specialists for second opinions, or you can call us on 9914941494. Thank you so much, doctor.